This is the Begin Within podcast, where we believe real, lasting health and fitness requires you to start inside before you work out. I'm your host, Nate Slegger, and I'm here to show you behind the scenes of fitness. You already know exercise is good for you, but what about all the other things in life that affect your fitness? If you're looking for extra motivation to get started or to make sure you keep going, this is the place for you.
Produced by BeginWithin.fit.
Improving health is about so much more than just losing weight. But I realize weight loss might be the goal that brought you here to the Begin Within podcast. That's why I wrote my latest book, 5 Ways to Stop Wrecking Weight Loss, to reveal the 5 areas that I see are most overlooked by the people that I work with who want to lose weight. Each one of the chapters in this free ebook describes that specific area that you need to focus on to improve your health and get great permanent results. And it also links back here to episodes of the podcast where we've had experts on the show talking about that specific area. So you can benefit from those previous episodes while you're learning about how to maximize the results that you're after. You can get your free copy of my ebook, 5 Ways to Stop Wrecking Weight Loss, by going to beginwithin.fit/ebook or going to the link in the show notes. Now is a great time to do a little multitasking while you're listening to the start of this episode. Head over to grab your free copy of my book, 5 Ways to Stop Wrecking Weight Loss. If you missed the URL, here it is again, beginwithin.fit/ebook. Or there is a link in the show notes for you. Grab your copy, and now let's get on with today's episode. My guest today is Dr. Jeff Crippen. He is a chiropractor, nutritionist, and coach who helps his clients to unlock their true potential at his clinic in St. Joe, Texas. He's also the author of the book Timeless Youth, and we're going to talk a little bit about some of the principles behind that, his own personal journey, as well as the placebo effect and how you could take advantage of that in your own health journey. Super interesting conversation. I know you're going to enjoy it. Please enjoy my interview with Dr. Jeff Crippen.
When I was a kid, I remembered getting some blood work done, and I filled out some paperwork. And the lady at the front desk said, "Son, I know what you're going to be when you grow up." And I was like, "Ooh, what?" I had no idea what I was going to be. It was like a kid. I was probably closer to an astronaut stage in my life of like what my goals were. And she goes, "You're going to be a doctor." And I was like, "A doctor? Why am I going to be a doctor?" She goes, "Because I can't read anything you just wrote." And that was like as close as I had any idea to what I was be doing now then. So I started getting headaches when I was 6 years old, and they progressively got worse. Took what you do, children's Tylenol, children's Advil, over-the-counter Motrin, kind of stuff like that. Headaches kept getting worse. I went to a pediatrician. Then they start giving you stronger drugs, prescription medications. And then, when a couple years in, those aren't working, or headaches are still getting worse. And eventually, they say, "Hey, this is like a red flag symptom, like progressively worsening headaches in a kid that don't respond to pain relievers. This could be something like really bad."
Yeah.
So they did a CT scan of my brain, found something. They didn't know what it was, then did an MRI. So it turns out what they found is something called a congenital arachnoid cyst. So it's a benign cyst about the size of a dime in the back of my head. So maybe about 1 to 3% of the population has it. And for any football fans listening to this, it was Urban Meyer, who was the head coach of the University of Florida and Ohio State. He retired from coaching twice because of headaches and stress, and he has that condition. So just a point of reference for any who know that. So, but I continue to go to the medical system, just looking for answers, right? I did what I knew to do, which is go to a doctor, trust him, try a drug, try another drug. If that doesn't work, try another drug. And then, eventually they're talking about doing brain surgery to take out that cyst. And if any of that would have worked for me, I wasn't here. But all through the while, when they talked about maybe that my headache was caused by the cyst, what never made sense to me is how could sometimes my headaches be bad and sometimes the headache be good? How could sometimes it be on the right side of my head or the left side of my head? How is the headache changing? But that cyst never was. And I had about 12 or 14 MRIs over the next decade that confirmed the cyst didn't change. So that kind of opened up a little bit of an awareness piece for me. And at its worst, I had a headache that lasted for 2 years, every moment, every day,
Wow.
kind of nonstop for 2 years. So it was like, it's like it changed my life for sure.
Yeah.
So it was through that, just searching for answers and just deciding, if I can't find a doctor to help solve this, I'm gonna have to solve it myself. And that kind of launched me on a journey that led me here today.
Wow. Oh man.
Yeah.
Awesome. Um,
Yeah.
could you talk about how that influenced the book? And obviously we're gonna tell people how to get their hands on that. But how that influenced your writing of the book, and then maybe we can get into that topic of the placebo effect a little bit that we touched on.
Yeah, that would be awesome. I'd love that. So how that impact is so I'm like I started getting headaches when I'm 6, they're peaking, early teens, mid-teens. And so I go through this and people are like, oh, everyone's read a book or read an article, and there's a tremendous amount of good stuff online. Tremendous amount. This podcast included tons of podcasts, tons of books, and they all have incredible information. But the problem is with all of them is how do you know what's right for you?
Mhm.
Going back to that word you that we talked about kind of in the
Yeah.
book title, but like, how do you know it's right for you? And so I remember people telling me, hey, did you know that coffee is good for headaches? I was like, I'm, 12. I don't drink coffee. And then other people would say, did you know coffee can cause headaches? I was like, still 12, right? But then it got worse. Then they were like, hey, do you know red wine can be good for headaches? I was like, now I'm 14 or whatever I am, right? And
Yeah.
then other people say, well, red wine can cause headaches. I knew enough to know that was possible, right, from overdose
Yeah.
syndrome. But the point is like, how do you make sense of the morass of knowledge out there and
Yeah.
try to figure out what's right for you? So, and I've, enjoyed reading, I enjoyed studying. I took some pre-med classes in college for fun. I took them as an elective. Before I knew I wanted to get into health, I was in there with like a medical physiology class, and everyone else is, pre-dental or pre-dentist, or yeah, pre-dental or pre-physical therapy or maybe pre-med, and they're all stressing about the class and how hard it is. I'm just like, oh, I took this as an elective, because it just interested me. So I wanted to understand what were some of the principles behind the techniques,
Yeah.
right? I heard once that if you learn the methods, you're forever tied to those methods. But if you understand the principles behind those methods, then you can think with them and act on them and understand them and really embody them. So
Mm.
at 6 and 12 and 13, I didn't know all of that. I was just trying to figure out health. But as I went through it and I encountered a lot of confusion, a lot of uncertainty, and a lot of overwhelmed, and a lot of things that maybe worked a little or didn't work or did work, I wanted to try to understand how that worked. And then I'm now a chiropractor and a naturopath. I've been practicing for a certified traditional naturopath. I've been practicing for a little over 10 years, about 12 years now. And so I'm, seeing a couple thousand patients a year and trying to understand how do you help the patients, right? How do you communicate them? How do you work with them on the mindset side? But also how do I make sense of the therapies to help the patients? And what are the principles that helped you look at 15 different patients and like I could have a headache and you might have a headache and that could be different. And then a teenage girl around her cycle could have a headache and that could be different. And then a college student on early Sunday morning after a late night could have a headache.
Yeah.
And that could be different. Or a football player or a hockey player could have a headache after a game post concussion. That's a different cause, right? So all those different causes, same symptom of headache, but all those different causes. But the solution, quote unquote, medically, is always aspirin or Tylenol or some kind of pain reliever. So I wanted to understand how could you understand the principles of what creates health. Then sub part of that is what actually causes disease, and then you can focus on what you need to do to restore health rather than treating disease. So an example of that might be, how do we get rid of the darkness? Well, you can fight the darkness all day, but the best way to get rid of darkness, as anybody knows, if you're fumbling around at 2 in the morning, right, is you turn on the light, right? And I think it's that simple with health. Like in the sense that we can spend all of our time studying disease and the molecule and the stuff that's happening and what's going wrong and what's not working. And, you can get more and more specific and dial down and dial down, dial down. And all of that's useful and there's incredible knowledge there, but none of it's health,
Mm.
right? Or we could spend our time understanding what are those principles of health and just do what we can to move towards health, knowing that as you're getting healthier, by definition, you're getting less sick. So
Mm.
that's kind of it. And then I wanted to understand, how do you get there? what is health? And that was the journey that I put, basically the 25 years of study and the 12 years as a doctor in practice. That's what I kind of put into this book.
Wow. Yeah, I know optimal health was one of the phrases I think in the bio somewhere that
Uh-huh.
I read, and we throw that around, and we've talked about it here, and
Yeah.
again, I realize this is 25 years of your research. If I was going to put you on the spot and just
Yeah.
see how you would define that, like what would you say is optimal health?
Yeah, and I think it's a really good question. I think that's a great one. There's a definition from the World Health Organization. I may not quote them on every particular topic, but on this one they say a state of physical, mental, and emotional well-being, and not merely the absence of disease or infirmary, excuse me.
Yeah,
But it's basically, it's not just sickness and not just not sick and not just not disease, but optimal function of basically spirit, mind, body. And I think that goes a long way to describing, to being one of the best definitions of health. Now, um, I think that's a great theoretical definition. Then you have to look at it functionally. Like if you go into your doctor and say, "Hey, I want to have optimal physical, mental, emotional, and spiritual well-being," they might look at you a little funny, like, you know what I mean? Like, I can order a blood test for you,
yeah,
or do you need an antidepressant, or whatever they may say. So the skill is the application of that. But that's a disease I think really, or that's a definition of health that moves away from disease that I think really goes a long way. So that's a definition I like, and I
yeah.
find quite powerful.
I like that as well. Nice. Yeah, very holistic.
Hmm.
Absolutely. Um, okay. Could we now I know you talk about this in the book, the placebo effect, and it's how it's connected to optimal health. Um, could we just dive into that for a few minutes and maybe just start with what the placebo effect is, as
Yeah,
though, someone's maybe hearing about it for the first time, even though we probably all have some concept of what it is.
yeah, I think defining that term to get started is a great place. So a placebo is basically a sugar pill. Right, and why they're giving people sugar is a whole nother story, but we'll leave that one there. But it's basically a sugar pill, and a sugar pill, it's used as, by definition, should be something inert or something inactive, in the sense that you take a pill that has an active ingredient, I take a pill that has no active ingredient, the placebo, and we're looking for, does the active ingredient make a difference in those who take it versus those who take the placebo? Right? And the reason this is important is every single drug on the market has to go through a trial, and every drug trial has to compare the drug to a placebo to find out, does it work. So medicine and drug trials are constantly trying to limit the placebo effect, right? Because they want the people who take the sugar pill not to get better, so the drug can show the least amount of improvement but be incrementally better than the placebo, right? And that's kind of the game there. So that's how it's used in medical research, is everything's compared to a placebo, and that every drug that's approved has to be shown to be more effective than a placebo against headache or heart disease or whatever the symptom they're tracking.
Mhm.
So why does that matter? What does that have to do with health? Well, one of the things I found fascinating is, and I hope your audience does as well, it's 30% of the people get better with placebo. So we've got,
Yeah.
so 30% of the people can take that sugar pill and start getting improvement. So that's, and from a drug trial, they're trying to limit that effect because, they want their drug to get approved. But from like a holistic health perspective, if 30% of the people can get better because they have hope, or because someone listened to them, or because they think something can help, that's a really powerful idea, right?
Hmm.
When we start looking at health as, just as a purely physical phenomena, that doesn't make any sense. When you start looking at health as spirit, mind, and body, you can really expand that out. So I think that's like especially when we look at health, um, it's the number one cause of bankruptcy. And in the United States, healthcare bills are the number one cause of personal bankruptcy. On average, we as a country are spending probably $10,000 or more per person per year. And we have a healthcare system that's not even in the top 40 in the world in the United States. Obviously, it changes
Hmm.
by country, but we spend on average twice as much as any other country in the US or in the world, the US does. And our outcomes, frankly, there's, 40 plus countries that have better outcomes than us. So the question is, what can we learn from that? So that's the idea of what a placebo is.
Yeah.
Now it gets even more interesting because there's a guy named Dr. Mosley. So he was an Olympic team doctor, an orthopedic surgeon, and he was a team doctor for the Houston Rockets, which is the NBA team down in Houston. And what he wanted to see is he was looking at people with osteoarthritis or arthritis of the knee. And there's two types of main surgery they can do. One is they can flush out the joint. So basically flush out the joint with all the irritants. And the second one is they can shave off the cartilage, kind of smooth it off to improve knee function. So he wanted to see which one's more effective, flushing the joint or the shaving the cartilage. But he wanted to do it placebo controlled. So there was actually three groups. One who was going to get the flushing, one who was going to get the shaving, and one who was going to get no surgery, which is like, how do you give someone no surgery? Well, anyway, that's what they did. They gave someone no surgery. So what happened is that all the patients were drugged. They all went under pre-op. The whole surgical team, they scrubbed in and prepped. And then the researchers gave the head surgeon a card right after, or right before they were actually going to do the first incision. And it said flushing, shaving, or no surgery, placebo. And so even if they did the placebo, they'd still make an incision. They'd act like
Yeah.
they were doing things. They talk like they were doing surgery, but nothing actually happened in the joint. And then they sewed everyone up, sent them to physical therapy. They all did the same physical therapy, and then they looked at the improvements. So the question was, who did better? Was it the flushing? Was it the shaving? Or was it the placebo? And the answer was there was no statistical difference.
Oh, wow.
So no statistical difference between the three groups. So Dr. Mosley said, he goes, I am, one of the top orthopedists, in the world. And he said, my skill as a surgeon meant nothing.
Hmm.
So the question is something as basic and as physical as knee pain, right? This is something where like the doctor takes an x-ray, they put that thing up and they say, see, Johnny,
There it
see,
is.
Mary,
Yeah.
you've got arthritis. We need to do surgery and here's why, right? Or they're showing them the MRI, right? And it's very clear and they point to it and they say with confidence, this is what's going on. And Dr. Mosley said, well, that may be true, but that's not necessarily the answer. The answer is not necessarily surgery. And we know that because those who got the placebo surgery did just as well as those who got the regular surgery. So it really
Wow.
opens our mind to the power of something I've heard you talk about on the podcast, but something on the power of mindset, the power of coaching someone, the power of hope, the power of a positive environment. So these are just fantastically, in my opinion, powerful ideas that the question is, how can we tap into, not to trick patients, not to fool them, not to do all this stuff, but how can we do that to help them get as healthy as they possibly can for the least amount of money or in the most effective way?
Hmm.
Because we know what happens. We know hope, being listened to, being understood, can be as powerful or more powerful than a surgical procedure in the knee, which costs tens of thousands of dollars.
Wow. Yeah.
Yeah.
How do we do it? That's my question. Are
Yeah. Well,
you? I'm absolutely blown away by that.
yeah.
Result with the knee surgeries. Because I knew there would be some. I knew you were telling me the story for a reason, but to for there to be no no noticeable difference in those results is just blows my mind. So yeah, and of course, I'm always curious of like what's the maybe the practical lesson that anyone can take away and begin to get some traction using that principle or the principles behind the placebo effect in their life when it comes to improving their health. What
I
are your
think the
thoughts?
first thing, yeah, no, I think that's a great question. I think the first thing to look at is just because it shows up on an MRI or an X-ray doesn't necessarily mean it's the cause, right? I'm not saying never listen to a doctor who gives you an X-ray result or all those sorts of things, but statistically, you can look at people with back pain and you can see, there's a whole bunch of healthy people that have a bulging disc that have no
Mhm.
symptoms, right? Radiography, radiological or X-rays of the hip and X-rays of the knee, you know, there is no correlation between the presentation, meaning what like the degree of joint space or how degenerated the hip and knee are, and pain. So basically, your radiologist can't look at your hip and predict your pain level, and they can't do it for the knee either. And why might that be? Like, there's a so I have a this comes from a part called the quantum principle, looking at the kind of the interaction of quantum physics and health. And basically, I keep it super simple. But one thing that I find really powerful is a quote from Einstein, and he said, "The field is the sole governing agent of the particle." So he was talking about physics, and they were trying to predict where the electron would go and things like that. But what they found is you can't predict the movement of the little tiny speck of the electron without understanding the whole energetic field that it's in. And I think that's the lesson for us, right? It's not about the hip or not about the knee or not about the pain in the head, right? What the doctors were really showing here is that if you listen to someone, give them hope, put them through, um, understand what's going on, but give them a plan of action, coach them positively, and give them a direction on where to go. That may be as important or more important than actually cutting on them with a knife. So the question is, how can we recognize that principle, and then how can we apply that in our life? So, I think there's a whole bunch of ways to do it. One way that I do, daily, and I recommend to patients, is just doing a gratitude process every day.
Mm.
Like, super simple, but just focusing on, what we can be grateful for, trying to put ourselves on the positive side of life. I show another study in the book that said, actually, uh, I'll pull it up right here, but it said, um, so exercise, we all know exercise is good for our health. Well, statistically, exercise adds about 1 to 3 years to someone's life, right? So someone exercises, they're going to have a positive, live longer by 1 to 3 years. Someone has an ideal weight, they're going to live about 1 to 3 years longer. Someone doesn't smoke. We all know smoking's bad, right? If you don't smoke, you're going to live 1 to 3 years longer. You optimize your blood pressure, you may live 4 years longer. Well, then they looked at what effect does a positive attitude have. They found it was on average 7.6 years.
Wow.
So that means the mood level you're in is more powerful than exercise, more powerful than your weight, more powerful than smoking, and maybe more powerful than optimizing your blood pressure combined. Not to say all those things don't matter, right? But this helps explain how we know that maybe we have like a great aunt or know of someone who's been smoking and having bacon every day and drinks
Sure.
scotch in the evening, right? And
Yeah.
they live to 100. It helps explain, I think, what we see in life, because we all know someone who does all the wrong things,
Yeah.
but seems to be happy and lives a pretty long life, right? And we know people who do a lot of right things that are still struggling with their health.
Yeah.
So I think recognizing that, I think, is incredibly valuable. I'll give you one more application of that is just asking yourself the question, describe your mood level, or just naming your mood level. So I'm
Mm.
happy, I'm sad, or whatever it is. And I'll tell you the significance of that. So they did a functional MRI study. So this is the one where they put you in an MRI machine and they ask you a question or show you some pictures, and they look which part of the brain light up, right? So if they show you
Yeah.
like happy, relaxing pictures, like the part of the brain that's like relaxed and happy, kind of that prefrontal cortex lights up, and they show you pictures like war or fighting. Um, then the fear part of the brain called the amygdala will light up. So anyway, they would do that, and that's what they found. Right? They showed somebody happy pictures, like the relaxing part of the brain light up. They showed someone threatening or fearful or anxiety-inducing photos, like war and famine and disease, and they saw that fear part of the brain light up. But then they did something interesting. So they asked those people when they were looking at those anxiety-inducing images to just name their mood level. So I feel fear, I feel anxious, I feel confused, I feel threatened. And what they said is as soon as they did that, the fear part of the brain stopped firing and the prefrontal cortex, the
Mm.
relaxing, the calming part of the brain started to fire. Now, why? I think the answer is in order to name the mood level, you have to get out of it to describe it. So an example, you can't
Mhm.
describe, or your listeners can't describe your house while you're locked inside the bathroom, right? To describe what the house looks like, you have to actually get outside the house. You
Mhm.
look at it, you look at the roof, the front door, the apartment, or wherever they happen to be
Yeah.
living. You have to get out of it to describe what you're sitting in. And just that one question, describe your mood level, forces you or gives you the opportunity to step outside of the mood level we're operating in, maybe unconsciously, maybe unawarely, maybe reactively, and separate from it. And once we do to describe that, by definition, we're outside it and we're separate from it. And just doing that can have a powerful effect kind of on your body, on your health, and kind of change the firing pattern in the brain.
Oh, I love it. That's awesome.
Yeah.
Great. And I love how simple, I'm all about easy here.
Yeah.
Health, easy.
Yeah.
Let's make it easy. And I love that you did that. That's
Yeah.
awesome. Can you tell us how we can connect with you, or we've mentioned the book a couple times where people can find that?
Yeah. So I'd love to do that. So my name is Jeff Crippen. So no doctor in it on Instagram. Just find me, Jeff, JeffCrippen. If you have any questions, we can continue the conversation there for sure. So that's where to find me online. I wrote a book called Timeless Youth, Youth, Timeless Youth, and again by me. And I wrote this book outlining the principles of what health is. And I actually wrote it for me or for the 6-year-old me, right? But really for my parents at that standpoint. But I wrote it for, you know, women who have autoimmune disease and go to their doctor, and the doctor looks at their blood work and says everything's fine, but like they know something's not right, or the solution to their autoimmune disease is, well, just take this, immunosuppressing drug to calm down the symptoms, right? Or so people who they're looking for an answer for what health is. They may be a little frustrated by what they found in the medical system, and they just want to understand, okay, I want another alternative to what I'm getting from my doctor just to get some more information, or I'm frustrated with that whole system and I want to know, what does it look like to actually create health, and what are the principles I need to follow? And that's kind of what the books are. It's the principles or the signposts. So you can think through when you come across these methods or interesting tricks or ideas that are super useful, but what are the signposts that you're moving closer to health? And how can you apply it, and how can you understand it? I like to think it's like just a mindset shift, because the biggest problem with our current healthcare system is that it has nothing to do with health, and there's no care or little care in that system, right? There's a lot of great doctors, there's a lot of great people in the system, there's a lot of great technology in it. So there's lots of positive things about it, but one of the things that aren't positive are the results in terms of creating health. It's a disease treatment system, but creating health is a totally different paradigm or way to view the world. And that's why I wrote this book, to help people understand that paradigm of what does it look like to actually create health. And that's the book Timeless Youth.
Awesome. Wow. Thank you, Dr. Jeff Crippen, for sharing your journey, your personal journey, as well as, the
Yeah.
knowledge that you've gained along the way with us. Those links will be in the show notes. Thanks again for being here.
Awesome. Thanks for having me. It was awesome.
I want to thank Dr. Jeff Crippen again for being here on the Begin Within Health Show. The links to his clinic site, as well as his book on Amazon, are in the show notes. If you'd like to check those out, you are welcome to do so. So those are there for you. I want to just talk for a minute about the power of mindset, which we talk about a lot here on the Begin Within Health Show. It is such an important pillar in our overall health, and our episode today was just such a great look at why that is, and also some of the science behind it, by looking at it through the lens of the placebo effect. So I'm so grateful for Dr. Crippen's expertise on the subject, but also for his research and for his ability to break it down and help us to benefit. So bottom line is this, friends: if you are working on improving your health, and I know you are because you're here, but you haven't addressed the pillar of mindset, and that's one of the big ones that we talk about a lot because it's so often overlooked. If you haven't addressed it, it's time. It is time to do so, and I'm grateful for Dr. Crippen's examples of how we can begin to address mindset in just some simple ways. For example, acknowledging things we are grateful for on a daily basis, and also taking just a moment to put a name, put a label on the feelings that we are experiencing and why that is so powerful. So just a couple of little tips there. I know in coaching, and this just came up the other day for me, often I'll recommend journaling, not as it has to be this extra weighty daily part of your routine, right? Like, oh no, now I've got to also sit down and write every single day. I love journaling. I do write something every day, but really the times that I write more are the times that I need to write more. As that habit has kind of evolved for me over time, I've come to understand for myself when it is that I need to do a little bit more writing about the feelings. And I think that is such a it's such a powerful habit for the reasons that our guest today mentioned, because it allows you to get out. You got to get out of the feeling in order to describe it, in order to look at it, in order to even label it. You have to be outside of it in order to write about it. You have to be outside of it, and once you're out of it, it loses some of its power. So in particular with negative feelings, right? Negative emotions, it can be such a healthy way to deal with them, to just write it out, or find someone to talk to. Those are just some real simple, real practical ways that we can begin to move in a healthier direction when it comes to those. So I would recommend, as an action step, of course, we talked about gratitude. We talked about putting a name to negative feelings, that perhaps using the tool of just writing in those areas. Just give it a try, maybe for a few days, for a week, for this next week, between now and the next time you listen to the Begin Within Health show. Could you just write something on a notebook page, or in your notes app on your phone? Just put a label on some of the feelings you're having, or maybe write down something that you're grateful for, or a few things that you're grateful for, and then just notice, just see if it helps you to shift into a place where you feel healthier, where you feel better. Just see. And if it doesn't, it doesn't. That's okay, right? Just give it a try and see what happens. We had an expert here on the show, and he recommended it. Let's give it a try. And I would love for you to report back to me on how it's going. I'm happy to help hold you accountable as a member of my community. So you can jump over onto Instagram and connect with me there. The link is always in the show notes for that. Another great place, and I don't talk about this a lot, but I want to invite you, before we close up the episode, to come and join us in our Facebook group. It is totally free, and what we're doing there every single day is we're sharing a very basic, very easy nutrition tip, and we're also sharing a workout that you could do at home by yourself every single day. So we're covering the bases there, the basic bases of nutrition and good, healthy movement. You can find it in our Facebook group. The link for that group, and it's free to join. I'd love to have you there if you're not already, is going to be in the show notes, along with the other links that we mentioned in the episode. Thank you so much for being here with me once again. If you haven't done so, please rate and review the show. That helps other people to find it. Thank you so much for joining me here, and I will talk with you next time on the Begin Within Health Show.